My questions really come from the perspective of digital and virtual and technology. And I want to start off just by asking whether you feel the CQC can fulfil a role over the coming years in terms of looking at regulation around the use of technology within the NHS, and if it does already even.
Well, that's actually quite a profound question, because we're clearly seeing a big transition in the way a lot of care is being provided. We saw that with the move towards online and telephone-based appointments to supplement face-to-face over the course of the last year. Interestingly, not just in this country, but around the world. That's the effect that COVID has had on the provision of health services. This question was already in view as a result of some of the changed GP services that were beginning to occur around the country, and CQC was having to decide what its regulatory stance was going to be there. So digital medicine, digital health is obviously going to be a bigger part of what the healthcare looks like in the future. So yes, CQC clearly need to think that question through. That's not to say, however, that a regulated approach to trying to drive change is going to be what's actually going to be the sort of fuel in the tank that's going to bring about more modern forms of healthcare. It's not going to be driven by the CQC. It's going to be driven by what patients and clinicians can see makes sense.